My name is Charlotte Molar, and I'm in cohort 1 from TTC, or Tarzana Treatment Center College. So I'm glad to be here.
Hi, my name is Jorge Silva. I am a faculty trainer here at Tarzana Treatment Centers College. I've been working with Tarzana Treatment Centers for almost 3 years.
So I'm Susan Knoll, and I am a full-time faculty member for the college. And today we're having a thought battle. Our topic is addiction really a disease or a choice? Some people will argue that addiction's a personal choice and that therefore anyone who addicted to a substance has ended up there because of their lack of self-discipline or morality. Meanwhile, others might argue addiction is a disease and as a result can't be cured entirely or even resisted by self-discipline alone. So the first view in terms of the choice model is the most common understanding of addiction. And it's, because of that, there's been a really big stigma around addiction and people who struggle with drug abuse, and that prevents them often from getting help. So we have seen recent studies over the past couple decades to bring in more evidence and show that the nature of addiction is really viewed more as a disease. But again, this remains a debate among specialists and the public itself. So the question that we're going to look to answer today is, does a person become locked into addiction because it is a choice that they're making and continue to make, or is it a disease that warps their brain and takes choice out of the question? So I think what I'd like to do, Jorge, start with you. From the perception of the disease model, how does the disease model define addiction?
So, the disease model of addiction is that there are many factors that contribute to the formation of an addiction. For example, psychological conditions, for example, anxiety, depression, PTSD. Also, some people are already predisposed in order to developing an addiction. So there are many factors that contribute to the development of an addiction.
Okay, awesome. And Charlotte, since you're representing the choice model, how does the choice model define addiction?
To be quite frank, I believe that, by choice, people have their own decisions, right? People make their own decisions as far as whether they want to, be a drug user or not, or an alcoholic or not. And, I think first of all, you're not born an addict. So I definitely think that, it's by choice. Like, you choose who you want to become, you choose whether or not this is right for you or this is wrong for you. So there's no specific definition that I think I can give. It's just a matter of, like, you're not born an addict. It's really by choice.
So then, there's kind of this common understanding it's by choice, but does that mean that these people who choose to be an addict have like poor morals and poor values? Because it seems like they're making bad decisions. We all know that, using drugs and alcohol can lead to some major consequences. So, like, do people kind of just have bad morals and values and that's why they make these choices?
Right, so that's a really good question, actually. I believe that just because you're an addict, right, doesn't make you have bad morals or values. I think it's defined by your character. So if you ask an addict, whether, what do they view themselves? What do they view themselves? I mean, they can make wrong decisions, they can make good decisions, but it doesn't lessen your value, if that makes sense.
Yeah, and that's where I disagree. I feel that or you know, in general, like my experience working here, my personal experiences, when you're an addict, it's much deeper than your choices. It goes back to childhood, your traumas, your the way you're dealing with the traumas. It is a choice that you're going to get into an addiction or you're going to self-medicate, but it goes much deeper than just a choice. It's, you know, for example, someone that is anxious or has low self-esteem, when you're anxious, you want to calm down, so you're going to do something that calms you down. You're going to take a pill, smoke something that's going to calm you down. But when you're, for example, depressed, you're going to take like an upper, and that's going to make you feel like you can do anything. So that's
Okay.
where, you know, I disagree.
So maybe with the disease model, you're saying there's some like deeper issues and, you know, I think I've read that with the disease model, they do say that some of those challenges at a young age with trauma, anxiety, and stress can change the DNA.
Yeah.
So I don't know, that's something on the disease side, but back to the choice model. So, you know, if someone says, okay, today I'm using drugs and alcohol, they become an addict, well then can they just choose to stop and then they stop being an addict? Because one of the next questions I want to ask is there's a phrase like once an addict, always an
Right.
addict. So it's kind of like, can they just wake up and say, I'm done being an addict, I choose not to be an addict?
Right, and thank you for that question. So I think, or I believe that, I don't believe in that phrase of, or saying that, you know, once an addict, always an addict. I don't believe that at all, because I believe that if you choose to become an addict, that is your sole decision, right? And I feel like, you know, just, I'm stuck, sorry.
Alright.
I think that being, you know, being an addict is just solely your decision. I mean, like, it's basically what I'm trying to say is that everyone chooses to become who they are, you know, and it's up to them whether they make the right decision or the wrong decision. So
Okay, well, Jorge, what do you say about that phrase? Once
So,
an addict, always an
Yeah,
addict.
you know what? It's, do you choose to catch diabetes or do you choose to become diabetic? You know, it builds up. So for example, if someone, again, it goes back to mental health. If someone is not dealing with their mental health, they're gonna deal with it with addiction or with addictive behaviors.
But are they always an addict? Like if you become an addict,
Um,
like why do they say once an addict, always an addict?
Because you already have that, what's the word? You're predisposed already. You have that addictive behavior, and that's when treatment comes in. 12 steps come in. You're trying to maintain your recovery, maintain
Okay.
abstinence.
Okay, and that's a good point, because I was gonna ask each of you from the disease
Mhm.
model perspective, what is the role of the 12 steps? As you're mentioning in the disease model, you just shared, you know, that's kind of to help with maintenance, maybe in recovery. What about the choice model? What is the choice model's perception of the 12-step program?
well, actually, I wanted to go back to what Jorge was
Sure.
saying regarding you know, the addiction and if once an addict, always an addict. Like I said, I don't believe in that because it's through their behavior, and you know they have to they basically make a choice. You know, they have to make a choice whether to become an addict or not. And it takes time. It takes time to recover from that, but you're not always going to be an addict.
Okay.
So regarding the 12-step program, the recovery part, I just, from what I've researched on, from what I know, you know, it helps you, it supports you, and it's an encouragement, it's accountability. How effective it is, I'm not sure, because people are different, but it's definitely a way to guide you to become sober and to prevent, from relapsing.
Yeah, the 12-step program, to me, it's almost parallel to like diabetic support groups, where you're treating the disease, you're taking insulin, but you need that extra emotional support, the extra, um, I guess, like identification with other people that are going through the same thing as you are. So that's uh, it's kind of like a support. I know you stated that it's a support, but it's also the treatment of the the uh, balancing between the emotional support and then the physical support of the disease.
Okay. Yeah, I mean, I can agree with that. I mean, I know his side is about the addiction is a disease and mine is by choice, but I can agree that it's the 12-step recovery or the 12-step program is more of like a support system, because you're going in there as, as yourself as an addict, and the rest of the crowd are also probably also an addict, so they are in support of each other. Like I said, they hold each other accountable for what they did. They can even probably have a sponsor, for their recovery. So, and it's also, like I said, it's also an encouragement, to get better and to possibly prevent from relapsing. So,
Okay. So some people say in terms of addiction, well, both my parents are addicts. Does that mean they have the disease of addiction and they're gonna give it to me and I'm going to be an addict?
So again, it goes back to the disease. For example, when your two parents have a disease, you inherit from them that possibility of developing the disease. For example, addiction. Again, diabetes. If your father, at least I know that if at least your father or mother have diabetes or both, you have the predisposition of developing diabetes as well.
Okay, but what if they, if we talk about addiction being a choice, if they chose to be addicts, they made a choice to be addicts, then, how does that affect me as their child?
right. So about that, actually, I think your parents are your influencers. So they, as a child, you're easily influenced by your parents. And when you're a child, you don't really know what's right from wrong yet. But as you get older, your brain functions differently now. So you get to choose between what's right and what's wrong. And again, your parents are your influencers. So what they bring, to the table is might is what you might do, but it's your choice.
But again, it goes back to mental health.
Mhm.
Like, for example, like I cannot say just because my parents are addicts, I'm gonna be an addict. There's so many more. For example, the trauma of having your two parents, you know, addicts, that can cause PTSD.
Right.
PTSD is a disease. It's a mental health disorder. So, it leads into addiction.
Yeah, but if you chose not to be an addict, it wouldn't have to come to that. You wouldn't, you know what I'm saying? Like, you wouldn't have to, if you made a choice not to be an addict,
Mhm.
then you probably wouldn't have that mental health condition, or you
Yeah.
wouldn't have to go through that, physiological problem.
But that's true, yeah. But it's so deep. Addiction is a deep-rooted disease. It's a family disease. It's a society disease. It's individual disease. So it affects everyone around you. It's an emotional disease where it affects you in every way. Your daily living, your physical, your mental health, and so yeah, it's a disease like any other disease.
So, addiction is not transmittable. It's not a communicable, known as something that's communicable. You know, it's not contagious. It's, you know,
Like
so
an
how do
infection.
you diagnose this?
That's a really good question. That's a really good question.
Whether it's a choice or a disease, like how do you
Right.
diagnose that?
I think you have to be honest, I think you would probably have to be using drugs or alcohol for a certain amount of time, for a long period of time, for you to become diagnosed, quote unquote, as an addict. Like, there's like a certain time, there's a period of time that you would probably have to be diagnosed as an addict. So that's something, that's a very like deep question that,
Yeah.
so.
But, and again, it goes back to, it's multi-factors,
Mhm.
many factors that contribute to the development of the addiction disease.
Yeah.
For example, your environment,
Right.
your predisposition to develop addiction, your physical environment, the people you live with, your mental health, and that's when the ASAM dimensions of treatment come in, where every dimension is
Important.
examined,
Yeah.
and it's very important because that's what contributes to the disease.
Right.
Yeah, it goes from mental health to withdrawal and withdrawal potential, your physical health, your mental health. So it's not just, oh, I'm gonna choose to be.
Yeah.
There's so many factors that come together. It's like a big puzzle that when you bring it together,
Mhm.
it's addiction.
Yeah, because for me, there's like a pleasure that, that goes along with that. So it triggers your brain, and, when your brain is triggered by that pleasure, when you feel good, like you feel, feelings of euphoria, like it just makes you feel like you want to continue using. And, I think it's your behavior that matters most, how you choose to become an addict. So I think, when they get a feeling of euphoria, it's like they don't want to stop, and they just continue to use.
Okay. So after talking about, diagnosing it, whether as a choice or as a disease, from each side, both sides, can you explain your perspective then on treatment? How do you treat this if it's actually a disease versus would you treat somebody if it's a choice?
So when here in Tarzana Treatment Centers, my experience has been that, we, let's say a patient calls and says, I'm looking for addiction, treatment for whatever substance they're addicted to, and that's when we do our assessments, our mental health assessments, if they have any pre-existing conditions, physical assessment, we do case management where, everything just comes together because it all contributes to the treatment, to the successful treatment of the patient. So it's something that it needs to constantly happen. Treatment constantly needs to happen because relapse is possible, and this is the beginning of treatment. When they come into our treatment centers, and that's why it's a disease. It's a multi-dimensional disease.
Yeah, and as far as with treatment, I think that you need to practice evidence-based treatment or evidence-based practices where there is motivational interviewing, where there's relapse prevention theory or therapy. And as a counselor, me being a future counselor, I think, a person who definitely needs help should seek professional help. And sometimes, they can't do it alone. So I recommend just getting professional help so that way, and as a counselor, you would want to, you definitely want to help them and guide them into, getting the right treatment.
What is the cure for addiction?
That's a good question too.
That's a good
Cure
Um,
for addiction.
There is no cure. There is no cure. There's treatment for maintenance, for relapse maintenance, or but there is no cure. Um, from personal experiences, many people with patients that I've dealt with, many of them sometimes will move to another addiction, or they'll relapse in a year, they'll relapse in 10 years, they'll be sober for 10 years, and all of a sudden there's a relapse. So it's more like a maintenance of the addictive behaviors.
Wow, yeah. I might have to agree with that there may not be any cure, whether it's a choice or it's a disease, because I believe that it's something that has to be maintained. But, if you have the willpower to change and you have the motivation, the proper help, from a professional, and you have support from the community, from your family and friends, you can fight this battle. So I mean, that's a very tough question to answer, because it's there. I know that, I said that once an addict, I don't believe in once an addict always an addict. It's really by choice. But as far as the cure, I think you just have to have willpower to overcome it.
But even willpower could be, not everyone has the willpower to stop. Everyone is so different that some people are ready to stop right now. Some people will be ready in 6 months, in a year. So I think that's part of the disease, that not being able to stop, not being able to and that's where it goes into the whole mental health, physical health, everything comes together, where a person might be happy doing drugs, or being an addict, and it's what do we do there?
Right.
Yeah.
I mean, based on my experience, I've worked with, I've actually worked with addicts, and most of the people working, in that job were recovering addicts, and they said that, they were able to fight it off. I've asked them, how did you do it, right? How did you overcome this addiction? And they just said, they said it's having the will to change. And if you want to change your life for the better, then you're gonna do it. And now they have a job, they're physically healthy, and they're mentally, they're like, it's just they're mentally there. They're present, they're mindful that, this can happen again, this can occur again. But, with the right support, you can overcome it. So
Yeah, and again, addiction is not the individual disease, it's a society disease, because we need to stop that stigma.
right.
When we hear addict or addiction, it's because I still see it even working at treatment centers. People have that negative stigma against addiction, against addicts, and that has to. I think we have to treat it as yes, individually, but also as a society. As for example, in the gay community, it was thought that, oh, because you were gay, you were going to get HIV, or HIV and gay are, hand in hand. No, that they have nothing to do with each other. They've affected each other. Again, society has to say, okay, you know, we're gonna treat our addicts with respect, our people that are suffering from addiction with respect and dignity, just like any other person that is sick or that is, you know, suffering.
What is relapse and why does it happen?
Okay, I'll go. From my understanding of relapse is when, you know, someone has been using for a certain amount of time and they stop using and, you know, they start using again. So I think, you know, relapse is very vital because, you know, for someone who wants to recover from being an addict, you know, when they see the drug is there, you know, they're very tempted, right? They're very tempted to take that drug and they just end up relapsing. So I think one of the what I was saying earlier about evidence-based practices is, you know, getting involved with relapse prevention therapy so that way they can help themselves or a professional can help them prevent them from relapsing again so that, you know, they don't need to start using and they don't have to go back to their old ways of, you know, of dealing with drugs or alcohol. So
Yeah, again, with the disease model, when you're diabetic and let's say your sugar goes really high because you haven't been eating properly or exercising, again, an addict will relapse because they haven't been active in their treatment, their mental health is suffering. So it, that's the whole relapse. The whole idea of relapse is falling again to your disease. Mhm.
So going back real quick to the choice model, do people choose to relapse?
well, to be honest, I would say so because, you know, I know that he's saying as a disease, you know, it's like having diabetes and, you know, they have to take that medication and, but with relapse in the choice model, I think they choose it only because if the drug isn't there, you know, they have a choice of whether they're gonna buy it or, you know, to consume it, or if it's there, are they either gonna take the drug and use it, or it's gonna, you know, they're not gonna, uh, you know, they're not gonna pick it up and start using, so.
But then, okay, yes, relapse. I do believe it. You know, I do believe that part that it is a choice. The way you're going to, and again, it goes into much deeper. Like, what is the person's mental state at the point that's leading up to the relapse?
Right.
Yeah, you know, their anxiety, depression, schizophrenia, bipolar disorder. You know, we have to look at the different factors that lead to the relapse for prevention, because it's again it's a multi-dimensional disease where we're constantly bombarded by different stimuli, and then we have to see and examine like how that's going to lead up to the relapse.
But some people, you know, it's their behavior, like,
Yeah.
it's their behavior, you know, you choose what not to do and what to do, and you choose to either take the drug or not take the drug, and like,
But then what's causing that behavior?
you're right, it's the
Yeah.
mental part of it,
Yeah.
but you know, if they had chosen not to take the drug, then they probably wouldn't have that mentality, they probably wouldn't have that mental health condition, you know, I mean, it's like, what, if I were to take the drug, you know what I mean, like, why would, you know, if I want to get better, why would I do it? I'm trying to prevent myself from having that, from having a breakdown. I'm trying to prevent myself from having, you know, PTSD or depression, and it's their behavior, it's just their behavior. So,
Yeah, relapse is part of the disease. It's part of like, you know, before relapse, you're maintaining the disease. You're leveling leveling it out. But when you relapse, it's like you're falling again into the disease. So, it's part of the disease. It's part of, like, for example, again, I go back to diabetes. If you're not taking care of yourself, if you're not addressing your mental health issues, your physical issues, you're going to relapse. And again, in addiction, it's a mental health disease. And if you're not dealing with your demons, you're going to fall back.
So today, the main point of this discussion has been, is addiction a disease or is it a choice? Can you share any final thoughts?
Okay, so, wrapping it up, I just think that, definitely addiction for me is a choice. I've been saying, it's willpower. Like, you're not born an addict. You are influenced by many people. You can be easily influenced by many people, and obviously as a child, you don't know what's right and what's wrong. You don't know what's right and what's wrong. But when you get older, we have a lot of research. We have you can get educated. You can get help, and with education and learning all this, all about addiction, you can fight it. And if you have the willpower to change for the better, I think you can make the decision of not using drugs, or even, taking like, a pill, or, just not taking any of those drugs, or drinking alcohol. So I think, a lot of definitely being educated, and I know mental health is part of it too. So, I think you just definitely have to seek professional help and get the right education, so that way you don't have to choose to become an addict.
I agree, but it's a disease. Addiction is a disease. Addiction is not only an individual disease, it's a family disease, it's a societal disease. And there's many factors that contribute to the disease. For example, you're going to find people that are addicted to substances in every walk of life, from the richest billionaire to the most poor person, the economic suppressed person. So it's an all-encompassing disease. It's maybe there are certain factors that contribute more to the development, again, to your family, to your environment, the way you were raised, what you were exposed to. But even that, not everyone that's exposed to those factors develop the disease. But there's a higher chance of developing it. So it's obvious that it's a disease, and as a society and as a nation, we have to really change our view of it in order to properly treat these individuals that are suffering from addiction.
Okay, well, thank you so much for your participation in this discussion. You both really brought a lot of great information, and it's been a pleasure having you.
Thank you.
Thank you.